so I will be eating that
I
up.
left the door
Oh, that's
open.
good.
If you take 2 fingers and place it underneath your jawbone, you can feel a pulse. This pulse is coming from one of your blood vessels. Your blood vessel is connected to a pump called your heart. All of your blood vessels and your heart comprise of your cardiovascular system. There is a role in healthcare that is specifically designed for understanding the system. No, it's not a doctor or a nurse. It's called a cardiovascular technologist. A cardiovascular technologist assists a physician during minimally invasive procedures and helps patients with their cardiovascular disease. For 2 years now, I've been in this profession. I have seen several different healthcare workers and helped out several patients. Today, I will share with you what cardiovascular technologists do, how they came to be, the versatility of the career, and how it can be affected by AI. So first, what exactly does a cardiovascular technologist do? I want you to imagine a blocked blood vessel like a clogged pipe. The blood needs to be able to flow and not obstructed. So you need a plumber. I prep the patient and get my materials like tools and medications and equipment ready. The physician places a hole in the blood vessel. As a team, we go in with balloons and stents and other equipment to restore blood flow and break up blockage. This allows the patient to avoid surgery like open heart surgery, which is way more invasive. Now that you understand the basics of the profession, now I want to go into how it came to be. Next, the profession began when advancements in cardiology allowed minimally invasive procedures to be safer and more common. Over time, nurses first took on this role, and then over time the need for more specialization and shorter education was required. And so cardiovascular technologists, that role was born. In 2024, an article from the Joint Review Committee on Education and Cardiovascular Technology stated in 1981, the American Medical Association recognized cardiovascular technology as a field. A few decades ago, that position did not exist, but now it does. And before, blockage in the heart was only able to be resolved by open heart surgery, and now we can do these procedures. In 2018, an article from the European Medical Journal states the first balloon was used in the heart in the 1970s, and it became commonplace in the 1990s. So that shows how exponential the growth in cardiology has been. This field and this growth has caused the creation of new modalities within cardiovascular technology and the need for more specialization. There's already several different modalities that a cardiovascular technologist can practice. The variety of roles that they can have is extraordinary. Of course, your blood is not just in your heart, it's pumped all over your body. So we can access other parts of your cardiovascular system. We can specialize in electrophysiology, which is to do with the electrical part of your heart. We can assist physicians inserting devices to help treat cancer. We can remove clot from the brain that has been formed that caused a stroke. And balloons and stents aren't only used in the heart, but they can also be utilized in the legs and other blood vessels in your body. This obviously shows the variety of things that cardiovascular technologists can practice. It's a versatile career built for the future. Lastly, it's hard to talk about the future without talking about artificial intelligence. A lot of times when this conversation is brought up, it's daunting or it's about job security. AI has been great for cardiology, not just for the patients, but also the technologists. In 2019, a study from the Journal of the American College of Cardiology stated that AI improves clinical decision making, medical image analysis, and procedures. Intravascular ultrasound, which is just a fancy name of saying taking an image inside the blood vessel, is one of these technologies that has been improved by AI. Before, the image was very grainy and not great, but with the use of AI in their models, we've been able to improve images, and technologists like myself have been able to interpret these images better that correlates with better patient outcomes. It's very obvious that AI complements cardiovascular technology. In conclusion, it is clear that the role of cardiovascular technology is growing. In a 2017 article by the Lancet Journal, it states that cardiovascular disease affects 470 million people globally, and it's the leading cause of death worldwide. With the rise of cardiovascular disease, there's a need for this profession. Today, I've told you about what cardiovascular technologists do, how they came to exist, the versatility of this career, and how it can be affected by AI. In the future, I hope when you feel a pulse again, you think of cardiovascular technologists and the contributions they have done for medicine. Thank you.